What if I were to tell you that the most common dysrhythmia that people walk around with every day is definitely going to be a dysrhythmia that your Next Gen or your NCLEX exam is going to ask you? What is it that you need to know in order to pass your NCLEX or your Next Gen? Stay tuned to find out. Okay, so all my nurse warriors out here, I know we don't have time to play because you're too busy studying. So we're just going to jump right into this video and discuss the patho of atrial fibrillation or A-Fib. Again, NCLEX is going to ask you on this because of safety. And this is a diagnosis that most people will have. Just your average people is going to be on med-surg. All right, so let's talk about the patho. Over here, you have your electrical portion of the heart, this being your SA node. It sends a message across both the right and left atrium. Comes down to your AV node. Your AV node is also going to be known as a gatekeeper, and we'll get into that in a second. Then from the AV node, the electrical current should come down here and go up to either the right or the left bundle branches. And finally, these little fibrous tissues that's out here is also known as your Purkinje fibers or Purkinje fibers, depending on who's saying it. So this is the normal flow. What happens is the electrical impulse comes in and it makes the mechanical portion of the heart do its beating, okay? So a regular normal sinus with the mechanical portion and the electrical current working the way they're supposed to be. Normally your atria is going to contract, bringing blood down to the ventricles. Then your ventricles are going to contract, and at the same time it's producing blood to either the lungs or throughout the rest of the body, depending on how it's coming out. So this is normally what's taking place. Now what happens when we have someone that's in A-Fib, your ventricles are going to pump the way they're supposed to. What happens is in the upper chambers of the heart, the electrical activity is making it quiver, occasionally squeezing and bringing blood down to the ventricles to circulate through the rest of the body. Now, as everything is quivering up here, we're going to have our blood that's going to stay here, and the blood's going to coagulate because it does this. Eventually, it will squeeze, bring it down to the ventricles. The ventricles will then contract and go to where it's going. But the potential of the blood clots is very high right now, especially if they're not on any blood thinners. Again, you might want to look up your farm for your blood thinners. And what's going to happen is when it beats, that clot can either go into the lung, now we have a PE, or it's going to circulate throughout the body. Depending on where it gets lodged at in the body, such as the heart or the brain, we're going to be worried about someone having an MI and or having a stroke. All right, so blood thinners is going to be the name of the game if there's no contraindication to the patient. So what's making this electrical activity in the ventricles quiver like this? Again, in a normal sinus rhythm, this is what you're going to see on the EKG. So you're going to have your P wave, your Q, R, S, and T wave. Everything's going to look normal. Everything's going to measure normal. Now, when we look at our A-Fib, your P waves are not easily to view. Okay, they're non-discernible. So that's where you get these little bumps on the electrical telem strip. What's taken place over here is there's like these little erratic impulses that's taking place in the heart itself. The SA node, typically the intrinsic rate is going to be 60 to 100. AV node, well, we'll skip the intrinsic rate of that. All right, so what takes place is all these little electrical impulses that's carrying away up here, misfiring. Since there's so many of them going on, they overtake the pacemaker of the heart because they're firing at a higher rate. That's why when people are in uncontrolled atrial fibrillation, that's why you see numbers that's probably going to be 350 to 450, possibly higher. If you're serious about passing your NCLEX, then sign up for a one-on-one meeting with me. I'm going to provide the link in the description. Again, this is at no cost to you. Let's knock out your NCLEX together. Beats per minute. This little chaotic activity is causing this. These are called wavelets. And there's really no P wave that we can actually visualize in this. So we can't actually count these. What the monitor is going to show is whatever the R waves are firing. So that's why a monitor could say, hey, this person's at 80 beats per minute. Yeah, their ventricular rate is that, but the monitor's not able to pick this up. All right, so that's basically the patho of what's taking place inside the heart, why we are concerned with blood thinners for the patient to have. There's going to be a lot more things we have to figure out and address for our patient, especially for their safety. I want you to leave some comments in the comments section and let me know what you think are other concerns and other questions that the NCLEX or the Next Gen is going to ask you. Before you go, I ask that you please click the like, subscribe button, and if this resonates with you, please put in the comments, Nurse Warrior. Also, if you are looking to have some assistance in passing your Next Gen, and you're ready to pass, please reach out to me. I'm going to leave the information on how to reach out to me in the descriptions above. All right, that's it. Good luck to everybody. Until the next time, happy nursing.